Welcome to Mindful Matters, the podcast where calm conversation meets everyday life. Let's take a breath and begin.
Welcome back. Mindful Matters. Being Mindful Matters. I have a subject here that I've done some study and research on years ago. Just now getting around to doing a video segment on it. The psychology of siblings with disabilities. You know, growing up with a sibling who has mental health challenges or co-occurring mental health disabilities, creates a unique psychological environment for the children. The research shows consistent patterns, elevated stress, identity shifts, and role changes, and emotional ripple effects across the entire family system. Core psychological dynamics. Siblings share genes, a home, and environmental climate of the family. When one child has multiple mental health conditions, the sibling relationship becomes shaped by stress load, parental attention distribution, and role expectations. Sibling psychopathology. Research shows siblings of children with disabilities have a roughly 20 to 30% higher likelihood of developing mental health challenges themselves due to shared genetics and environmental stressors. Some common outcomes of that would include anxiety from unpredictability or fear of crisis. Okay? From unpredictability of fear of crisis. Okay? That's the anxiety. And the depression from feeling invisible or overburdened. ADHD like symptoms due to chronic stress. Behavioral issues from emotional overload. Okay? The glass child effect. Siblings without disabilities often become glass children, children who appear strong but feel unseen. They may experience feeling overlooked because parental energy centers around the child with needs. Yes, we know all about that. Suppressing their own emotions to not add more stress. Confusion about their siblings' condition, not understanding. See, that's why in this situation, the children need to be taught things. They need to be able to understand what's going on, and that helps them. Okay. Difficulty forming their own identity. That's one that I see as well. Parentification and role strain. Studies show siblings of children with mental disorders often take on adult-like caregiving roles, which lowers relationship quality and increases distress. This can lead to hyper-responsibility, emotional exhaustion, resentment mixed with guilt, difficulty setting boundaries in later relationships. Okay. Family system ripple effects. Mental health challenges in one child affect the entire family. Okay. It affects the entire family. And that's fact. Research shows bidirectional influence between parental mental health and sibling mental health. When parents are overwhelmed, siblings absorb the emotional tension. Household stress becomes chronic. Sibling conflict or distance increases. That's I see that too. How co-occurring disorders shape the sibling experience. When the affected child has multiple conditions, for example, ADHD plus anxiety, autism plus depression. Okay, the sibling experiences unpredictability, meltdowns, shutdowns, and crisis. Inconsistent routines, divided parental attention, heightened vigilance. Okay, it's they think to themselves, is it going to be a hard day? Is there going to be issues? They think like that, and they do. Identity distortion. Okay, I have to be easy one. I have to be the easy one. You're concentrating on things that you shouldn't. The child, um, not taking care of themselves. Protective factors that improve outcomes. All right, research identifies several buffers that reduce sibling distress. Okay, clear, age appropriate explanations of the disability. Okay, this is what I was talking about. One on one time with parents, reduced caregiving expectations, external support. Okay, mentors, youth groups, or therapy. And try to keep a healthy parent mental health. These factors help siblings feel valid, safe, and emotionally seen. Okay, I'll leave some resource links if anyone wants to continue on learning anything about this. But that's a little bit of psychology of siblings with mental health issues. I experienced that with my children. They pretty much everything I read is a fact. And like I said, I'll post some resource links for anyone interested in continuing education. So everyone have a good day, stay safe and peaceful.